As we mark the one-year anniversary of Ontario's first declaration of a state of emergency, the agenda this week looked back at how a new coronavirus spread across this country and asked whether the pandemic exposed some weaknesses in how democratic governments responded. The agenda's Week in Review begins hearing from family caregivers about this COVID year in long-term care.
Sherry, maybe you can start us off here. I want to know more about what it means to be, quote unquote, an essential family caregiver and what that has meant for you over the past year. Start us off there, if you would.
Well, I can tell you the first 6 months was very long, 6 months waiting and wondering when we'd ever be able to get back in. So when we were able to last summer hear this word of essential caregiver, it was exciting and thrilling to think we might be able to get back in. And so in our case, we were able to get back in late August of last year, which was 6 months. And it was just so, I can't tell you the feeling of being able to go back in and hug my dad for the first time. It was wonderful.
Can you tell us a little bit more about that moment? Going that long a period of time without being able to hug or kiss a family member, particularly a parent, must have been just gruesome. So how did that moment go?
It was a bit odd because, of course, the staff there, they're seeing family members come in for the first time, and it was all a little bit. Everyone was a bit trepidatious, not wanting to get too close to one another. The staff were excited to see us as well, but it was really, really exciting for me to go in. It was very, very emotional. But very good on the same hand that, we were going to be able to go in more regularly and get on a schedule again and see them. Even though, they might not remember us, it was still good for them to have somebody besides the staff have their eyes and ears on them.
Right. Julian, let me bring you in right now. And as I do so, I'm going to ask our director, Sheldon Osmond, to bring up a picture. And I'd like you to tell us who the three people are in that picture.
Well, in the middle is my bonus mom. I call her my bonus mom. That's Mary Lou Kennedy, and my lovely wife Heather on the right, I guess, and I think me on the other side. And we were celebrating her 92nd birthday at her my brother-in-law's home, and that was last year. That was last year, 2020 in March, actually.
Now you call her your bonus mom, but she's your mother-in-law, right?
Yeah, I call her my bonus mom. I call her my second mom. I like the term bonus mom. I have a bonus daughter too, so I call her. She's really that special to me.
And what was important about that moment that you got on camera there?
Well, it was her birthday, and we were celebrating. We were just about to leave, and I don't know. It was just a shot that happened, and we had had a great evening. It was just before the pandemic happened. It was just before the lockdown came into effect, of maybe a day or two, and we had brought Mary Lou over and celebrated her birthday together with her family, and everybody was there, and we had a great time. And she was fluent. Lovely, fun. I did a bunch of video as well.
Great. Yeah. Crystal, tell us the significance of the past year for you in terms of this story we're covering tonight.
Well, this story tonight has a huge significance for me because my mother's on a secure unit, and during the pandemic, a secure unit's where you lock up the people that are shoppers or walkers. It's a small prison in long-term care, basically. I know people don't like us to use those words, but what I watched happen to my mother on the secure unit over years, and what we watched through the pandemic, was deterioration. And it was horrible to stand outside there in the window. I could stand outside and see my mother inside, and I could see the deterioration of the other residents. So it was very, very, very difficult. And for me, the pandemic has been about advocating for the rights of family caregivers and all the other residents in the home, because we have 238 residents in our home, 4 floors. What I could see on the small little 17-person secure unit, we knew was happening throughout the home. So it was very tragic for me.
The only weapon we had against COVID in March and April of last year was in staying apart and using measures like hand hygiene and wearing masks to prevent droplets from getting from person to person. And so all you could do at the beginning was to go broad and say, we need to stop transmission of this virus. And we're probably willing to go overboard. We'd rather go overboard with stopping transmission than go under, which means that we're going to do everything we can think of. The goal was to stop everything that was not essential to life in the next 2 weeks. As time has gone on, we've tried to get a little more sophisticated about thinking about where the risks are. You know, as Dr. Furness said, we figured out that it's droplets that are the major issue. So now you can start talking about how well masks work. And that means that the high risk places are the places you take your mask off. Okay, so restaurants are a particular problem, and we can get a little smarter about what things we can have open and what things we cannot have open. But we're still really struggling, I think, with what we want to have everything open up to the limit of, you know, letting the cases go too high again and overwhelming our healthcare system and having too many people die. Figuring out where that limit is, it remains a really difficult thing to do.
Yeah, Jennifer, maybe you can pick up the story there, because clearly places like Toronto and Peel, the nation's capital for a piece as well, were really suffering. But then you got lots of places north of the French River where they were having no cases at all, and yet the entire province was being shut down. What had to happen for the government of Ontario to say, you know, we can take a bit of a more systematic, sophisticated approach to this? We don't have to shut the whole province down, just the areas that we're really concerned about.
Well, you know, I think it's still very much an open question as to what the best approach for locking down is, and whether, you know, regions should be locked down together or if entire swaths of the province should be locked down simultaneously. There is research showing that it doesn't work as well to lock down in a piecemeal fashion when there's high mobility between areas. And so, you know, some studies out of Europe, for example, have shown that lockdowns are more efficient, more effective, and faster if you lock down a big, you know, area, big geographic area with a lot of interconnected movement, versus just some of these very targeted, small, local lockdowns. And actually, I think in Ontario, we've seen that just locking down some regions and not others creates what they call these leaky lockdowns, where people will move from a hotspot like Toronto to, say, Niagara region, where there were lower case counts. And, you know, I spoke to the medical officer in Niagara, and the first 6 variants of concern that they detected in that region, 5 of them were linked to travelers from Toronto. So, you know, Toronto was in lockdown, Niagara had opened up a bit, but that kind of movement was happening.
Colin Furness, can I get you on that? I mean, we before we started taping, we joked about the fact that Toronto was in lockdown, but York region, just on the other side of Steeles Avenue, wasn't. Does it make sense, when obviously the virus does not respect Steeles Avenue, does it make sense to only lock down the city but leave the region on the other side of the street open?
The problem with doing big, wide lockdowns, although they are efficient, is that they cause more harm. There's going to be less capacity to do that without getting really harmed. I think what we didn't do is enough public education to say, please don't do this, and here's why. We pleaded. Mr. Ford's been on TV pleading with people. No question, he's been doing that. But I think you can't just tell people what not to do. You need to tell them why. And I think we have not, as a province, as a country for that matter, done a decent job of public education before the crisis as well as during the crisis, just in terms of how public health works and how communicable disease works. So I think we could have done a better job, but I'm not sure locking everything down all at once would be sustainable for the lengths of time that we've done it. Okay, fair enough. Kelly Lee, let's pick up the story with tracking and tracing cases. There are those who say, in public health, these are hugely important things to do in order to get a handle on the virus. How well have we done at that?
Well, it's a mixed picture. I think, well, early on, if we go right back to the beginning around New Year's, the Public Health Agency of Canada did actually pick up the earliest signals. We have something called the Global Public Health Intelligence Network, GPHIN, which actually provides that early warning data. And it did report on December 31st when everybody else also heard about these cases. The problem is that we don't have a robust system of actually doing something with that data, that we don't have a system of risk assessment and then really firm decision-making to take forward actions that are needed. And we found this out, as we went along.
Let's start with this graphic here. A year into the pandemic, we want to just sort of take stock and see how different jurisdictions around the world have been coping. So Sheldon Osmond, if you would, let's bring this up here. This is COVID-19 confirmed deaths per million people. And the United Kingdom is actually at the top of this chart, 1,851 confirmed COVID deaths per million people. The United States comes next, 1,614. Then the European Union, just under 1,300. Canada, just under 600. Australia, 35 and change. New Zealand, well down the list, only 5.4. China, 3.4. And Taiwan, less than 1. That from worldindata.org. Ian, start us off in this. The Director General of the World Health Organization declared last month that, and here's the quote, "In many ways, China actually is setting a new standard for outbreak response." So let's start with that. Has the authoritarian Chinese dealt with this pandemic better than the democratic West?
Ish. Number one of all the numbers that you put up there, that's the Chinese number is the one that deserves an asterisk. We don't completely buy that they've been straightforward with their people or the rest of the world about exactly how many people have died from COVID. The numbers are not going to look like American numbers, but they're probably a multiple of the numbers that they're actually showing. Secondly, we do know that the fact that the Chinese government covered up the initial outbreak, human-to-human transmission of coronavirus for weeks, while hundreds of thousands of Chinese from Wuhan were leaving, not just Wuhan, but leaving the country. This pandemic would not have occurred if the authoritarian Chinese government had been as responsive and as transparent about the outbreak as the Canadian government, the American government, the Australian government would have been. So it is disingenuous to simply say China wins on the back of all of this. But certainly after the Chinese took recognition of what had happened on the ground and started combating it, they've been incredibly effective. For a country of 1.4 billion, they have incredible surveillance. They have extraordinary authority. They have the ability to lock down their people. And that allowed them not only to restart their supply chain really by last May, June, while the rest of us was still reeling, responding to coronavirus, but it also meant that China was the only major economy in the world last year that experienced growth. So both from an absolute healthcare and numbers of people killed perspective, and also the ability of the economy to rebound, there have been real capacity that the Chinese authoritarian government has shown that they can indeed respond effectively to a pandemic. Well, that leads nicely to my next question for Amir, which is that, there is an argument that Western democracies are making that we ought to be better at fighting pandemics because, of course, transparency is a big part of who we are, public trust, collaboration among different levels of government and with society, and therefore we ought to be better than authoritarian governments at fighting these kinds of global pandemics. What does the past year tell you about how firmly we can make that argument?
I don't think you can. I simply think the data that you showed, Steve, is unarguable. Certain governments categorized as democratic have done an awful job. Certain others, New Zealand, Australia, have done a brilliant job. Taiwan, and more than that, by the way. Look, at the end of the day, this is the point that I think is overlooked in the debate. The number of deaths you get from COVID is both because of an agent and a cause, but the virus is not the cause. The virus is the agent of disease. The cause of the disease is the strength of your political institutions and their resolve to fight the virus, be it an authoritarian state like China or a democratic state like Canada. The agent of all those deaths is government in both cases. And what we've seen is that you can have a strong agent that stands up against, a strong cause in the government standing up against the virus. In a democracy or in a dictatorship, it doesn't actually matter. What matters to this apolitical virus, the virus has no politics. It doesn't care about democracy. It doesn't care about dictatorship. What matters is the strength of the measures you adopt to fight it.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.